Jackson Austin Pritchard. Let me check your wristband. Jackson Austin Pritchard, date of birth 1/29/19. First, I would assess his temperature, blood pressure, pulse, respirations, and I just took his temperature axillary, and it is 98.2, which is in the norm. It ranges from 97.5 to 100.3. Then I would take his blood pressure, and typically they do it on the calf, and it is 70/40. And his respirations, I would listen, and the normal is 30 to 50, and he's right at 30, so that's considered normal. And his heart rate, the normal range is from 90 to 170, and he is sitting at 120. And I'm also listening to his heart sounds while I'm counting his normal range for his heart rate, and they're normal, clear, and full. And then I would also, while I'm doing that, right after, I would listen to his bilateral breath sounds, and they are clear and full. And then I would assess the head, and I would check for molding. He has no molding, and I would use the pads of my fingers to do so. And then I would gently feel for his fontanelles. And then I would also check for his suture lines after birth. And then there's caput, succedaneum, and the cephalohematoma. And he was actually born with a caput, and it's basically like a bump on the head that's contained with serous fluid, blood, a few different things. And then the cephalohematoma is when blood gathers between the scalp and the skull. And then I would note any scratches or bruising after birth, and he has none. And then I would note the placement and the symmetry of his eyes. They're both symmetrical and even, and straight on his face. And then I would note any discharge. He has no discharge from his eyes, no hemorrhaging in his eyes, and then he doesn't have any epicathal folds. Then I would check the position of his ears. They look symmetrical, and then I would check the flexibility, and then of the recoil and the cartilage, and it's quick and right back to normal. I would check the position and the patency of the nares of the nose, and they're equal. The cartilage seems fine and great there. And then I would check his mouth, and I would assess and palpate for the closure of both the clefts, and both of them are closed. He has no cleft palate. And then I would also assess his suck reflex. He's not very hungry now, but he would suck, because that is normal to do right out of the womb. And you just stick your finger in your mouth, and you rub at the very top of the roof of his mouth to stimulate that. And then I would check for masses on his neck, which he has none. And then I would check the range of motor of both of his arms and both of his legs. So let's check that. Let's check that. Go all the way around. He has great range of motion all the way. He's fighting me, but a newborn would not fight you. Range of motion looks great. And then I would also feel if his clavicles are intact, because sometimes during birth, if it's a hard birth, they can, one or both can break depending on the severity of it. I would check his skin color. He is pink, warm, and dry. Yes, you are. And then I would try to look for any peeling, birthmarks, or rashes. And he actually does have a butterfly right behind his neck at the bottom of his head. Yes, you do. Butterfly kisses. And then I would check for Venix. Of course, he had some Venix long ago, and no bruising though. And then I would check his skin turgor, and it goes down just fine. Yes, it does. And then I would check for 5 areas of jaundice. And he was born with jaundice, and we noticed it in his main areas. He had it all over, but at first it was his trunk. But the 5 places you would check would be the whites of his eyes, his forehead, the chest, the abdomen, and the inner thigh. And then 5 signs of respiratory distress would be retractions, which is where the chest in between the pecs would go and really, really far. Grunting while they breathe, nasal flaring because they're trying to breathe really, really hard. Seesaw respirations, and then also like quick, rapid breathing. He was actually born premature, so he did have respiratory distress syndrome, and he had very severe retractions. And then I would listen to his bowel sounds and make sure they're active. And then I would also note the shape of his abdomen, and it is round. It's not frog-like, that wouldn't be good. And then I would also palpate the abdomen, make sure there's no masses or anything that's stimulated that bothers him. And then I would check his umbilical cord. It's moist, it's not dry. And then I would note any discharge or redness from the umbilical cord area. And then for genitals, I'll do male first. I would palpate his testes. Let's see if he'll let me even do it. I would palpate his testes to see if they were descended or not. And then I would also look at his meatus and see if it's under or over, but it is center and at the very top. And then his rugae on his testes are slightly there, not all the way yet, since you were early. Yes, you were. And then he does have absence of foreskin because he was circumcised at 2.5 weeks. And then for a female, there can be some edema, some not. The majora is covering the minora. And then I would look at muscle tone. I would feel resist, which he's got a lot of. Resist and recoil. And recoil. Yeah. Recoil. And then I'm going to check the creases on his hands. Yeah, there's quite a few. And on his feet. There's quite a few there. And then I would note how many digits. So there's 5 on this hand, 5 on this hand. So 10 fingers and 10 toes. And then I would check the Babinski reflex. And his toes would curl in. And they just did. Would curl in. Okay. And then I would check the contour of his spine. So I would just turn him over simply like this. And his spine is center and straight. And then he does not have any tufts of hair or dimples on his back either. And then next, I would check his Moro reflex, and I would hit the side of the bed. He kind of did it, but a newborn would go straight up with his arms, well, should go straight up with his arms and straight out with his legs. Since it's the behavior reflex. So then I would verbalize his behavior, and he's been very good. He's very tired, I know that, so I'm surprised, but he's been very good. Calm, settle, easygoing. And then his last stool was this morning at 11 a.m. and his last void was at 6 p.m. 6:30, might need to check that again, but that's when his last diaper change was. And then he is due to eat at 8 p.m., early bedtime tonight, but an infant would eat every 1 to 2 hours of breastfeeding and 2 to 4 if on formula.